Can I welcome everyone to the meeting of the Adult Services Scrutiny Panel. Before we start the meeting proper, as it is the first meeting of the new municipal year, we need to confirm the convener. Can I just ask all panel members by raising their hand if they can show that they're happy for Councillor Sue Jones to continue as convener for the municipal year? Okay, thank you very much. And also, can I ask you to indicate that you're happy for Tony Bedu to continue as a co-optee on the panel for the new year? Great, thanks very much. I'll hand over to Councillor Jones to continue the meeting.
Thanks, Liz. Well, item 2 is apologies for absence, Liz.
We've received apologies from Councillor Chris Holly, Michael Locke and Alan Jeffrey. That's all, Chair.
Lovely, thank you. Number 3 is disclosure of personal prejudice and interests. Are there any? Cheryl, you've got your hand up.
Sorry, it's legacy.
Okay.
Yeah, sorry, Sue. Yeah, I've had a family member having some assistance from social services.
Thank you, Jeff. Anybody else? Lovely. Item 4, prohibition of whipped votes and declaration of party whips. And item number 5 is the minutes of the previous meeting. So I go to page 1, page 2, and page 3. You've also got the letters there. Can I have confirmation that you agree with the minutes? Cheryl, you still got your hand up.
Yeah, sorry, Chair. I just can't get rid of it. I'm trying always.
No. Okie dokie. Welcome, Dave. Can I just, before we go on, invite the people that are in the room to introduce themselves? Sorry, I forgot earlier. Sue Jones, the convener.
Liz Jordan, Scrutiny Officer.
Councillor Louise Gibbard, Cabinet Member for Care Services.
Lucy Friday, Principal Officer for Transformation in Adult Services.
Amy Hawkins, Head of Adult Services.
Councillor Paxton Hood-Williams, Fairwood.
Thank you all. As I say, we've done the letters for information. We go to public question time now. Are there any, Liz?
No questions, Chair.
Okay, we go to item 8, role of adult services scrutiny performance. I assume you've all read the minutes, the report, and if any of you have got anything to add on item 4.1, can you indicate with raising your hand? Okay, we accept the report then for last year's, and it gives a good outline of what we are, what's expected of us. So thank you for that. We now go on to item 9, annual performance report. Who's going to take the lead? And Louise, do you want to say something first?
Yes. I'll just go give a quick overview, and then if I've missed any key points, then I'm sure Lucy and Amy can come in. So this is our annual return for 24-25, and it's part of our statutory reporting to Welsh Government. But I think importantly, it gives us a really good chance to reflect on how we've been doing and what's working well, and what we're focusing our efforts on. So just to note, you'll have to correct me if I get this wrong. This includes data as of the 31st of March, doesn't it? But doesn't include the sort of ins and outs throughout the year, which is another 1,200 people approximately. But nonetheless, it does provide us with a really useful snapshot with some really good quality data. So some key messages from the report. In referrals and early help, we've seen a 24% drop in our total contacts to the common access point. And interestingly, more of these were new contacts, so 45%. So that suggests that once in the system are much more confident going to the right team later on for further queries, and then that frees up the capacity in CAP, which is really good news. And also 61% of those new contacts were supported through advice or assistance in the first instance, which is a really good improvement. And this does tell us then that our front door redesign is working, and people are getting the right help much earlier and we're reducing that unnecessary demand on our teams. That's good news. In assessment and reablement, assessment numbers have stayed steady, but what's encouraging is that more people, 18%, have had their needs met without needing a formal care plan, up from 11% last year. So reablement services, they're also making a real difference, with 71% not needing ongoing care afterwards, a 10% improvement there. And again, that really shows how we're helping people to stay independent and not resort to care plans. Care and support, we now support 4,102 adults in this report anyway, up from 360. So obviously that is an increase. Nursing care placements have risen by 28%, as opposed to domiciliary care starts dropped by 6%. But that shift tells us that there is something about changing needs, which I think we've discussed at this panel previously. On a much more positive note, we've doubled the number of carers receiving support plans, 435 this year, up from 178 before. And that reflects our partnership working with the Carers Hub, the Swansea Carers Centre, and the co-design support services there. In safeguarding, we have received more adult at risk referrals this year. But I think in some ways that's a good thing, because it's showing increased awareness of the people, where people can go. There is on the downside, we have seen that 67% of inquiries are completed within 7 days, down from 83%. But we are addressing this with much more resources, but also targeted education from the other services making those referrals to make sure that they're appropriate. I know the team have also implemented a sort of RAG, red, amber, green rating for referrals, so to make sure that the most urgent cases are being dealt with quickly and appropriately. So I don't think we need to worry too much about that, but because we know that the serious cases are being dealt with, and some of them are perhaps not appropriate referrals in the first place. So overall, I think we are seeing, this report shows that we are seeing the benefits of that early help and reablement work that we're doing. More people are being supported without long-term care. Care is better supported. It's helping us. We're definitely making progress against our target operating model, as we talked about before, shifting more work towards that early help and prevention space. Just a further note, as Lucy was saying, suggesting to me, which an idea perhaps for the panel, is that our annual census return, which includes everyone throughout the year, which this doesn't, is perhaps we could amalgamate, those two reports, that one and this one, and in which case that would be brought later in the year, Christmas and New Year, rather than this one, which is sort of an interim. But anyway, so I don't know if Lucy, Amy, you want to jump in with any more detail that you think is relevant or important that I've missed out there.
Thank you, Louise. Thank you. No, that was really comprehensive. I suppose it's just to reiterate the point that it is hopefully demonstrating that certainly with new contacts into adult services, we are seeing improvement in line with our target operating model for sure. So we understand that we're already, even though a relatively short period of time has passed, this is only reflecting on 6 months worth of real kind of change and improvement activity. We're already seeing that impact coming through in terms of the stats, which is really, really positive. It reiterates, and I suppose it just reconfirms what we know our pressure points are in the system as well, and we recognise those in our target operating model. So yeah, overall, I think that Louise covered it all very comprehensively. But yeah, we're seeing ups and downs in the right direction generally, and it's also reconfirming what we knew we had to focus in on. So hopefully it's helpful to panel members.
I think it's a really positive report. Yeah. I'll open up for questions. Now, anybody any question? Or Amy, do you want to say? Sorry, Mella.
No, I was just going to say, actually, I really think it's covered. I suppose what I just say in a kind of summary is that it does show as well the quantity of people we're dealing with. You know, it's a really large service. These are really large numbers of people. You know, we're having over 14,000 queries a year. Over 5,000 of these are brand new people not known to us. And I think so that huge amount of volume every year. And as Louise has already said, the numbers you see here is a snapshot at the 31st of March. And so during the year, we're dealing with more people again. So if we can bring those two reports sort of amalgamated, it will give you more of a picture of the flow throughout the year that we deal with. But as both Lucy and Louise have said already, you know, we're really seeing our strategies start to be implemented, or the impact of those strategies. So our 3 Ps that we've talked about before, our target operating model, and our 3 Ps around prevention, prioritising resources and promoting independence. So yeah, pleased to bring this report to you, and we will keep telling you during the year this performance information as well. So thank you.
Thank you both, three of you, not both, it's just three of you. Are there any questions? Who's that? Mark, do you want to ask your question?
Thank you, Chair. Afternoon, all. Very extensive report, Louise, very impressive. I noticed that there's been an increase in the people in the care system by several hundred. I wonder if the resources to meet that demand has been met, or are there plans to increase the resources? Thank you very much.
Thank you, Mark.
Well, everyone who's come forward, you know, I'll reassure you, everyone is having their care needs met. But I think, as we've discussed before, I think in the long term, that sort of situation isn't going to be sustainable if the numbers and the complexity keeps going up, and which is why we are doing this work to try and work with people much earlier, and you know, the re-ablement about keeping people independent at home, that is so key for a resource point, but also, you know, because that's what's better for individuals and their families, really. I think it's that cover that.
Lord Mayor, would
Thank
you
you.
like to ask a question? Sharon?
Thank you, Councillor Jones. Not here is LM today. Here is just little me. Thank you. It's within the safeguarding paragraphs. I was a little bit intrigued, is that the right word, where we've got a particular increase in ambulance service referrals has been made. However, this has highlighted an area of focus for the year ahead to engage with. And I was just wondering what sort of like prompted that paragraph.
Thank you. Yeah, just to expand on that, we understand from the safeguarding team that a number of those referrals were perhaps inappropriate referrals. So they understand that there's a training need there that could be undertaken to reduce that kind of unnecessary demand, if that's the right term. Of course, as Louise explained, it is about making sure that everyone understands their responsibility, and it's a good thing in some ways to see that increase. But whereas the safeguarding team with their resources have been focusing on making sure that the right referrals are made at the right time, that bit of extra education and time spent with the ambulance service might reduce that unnecessary demand, which obviously gives the team capacity to focus on the true demand that's coming through. Hopefully that clarifies that point.
Yeah. I was just wondering if there was a trend of complaints. You know, I actually think that the ambulance services are under a huge amount of duress from calls, and also the waiting times that they have to wait outside hospitals. So I just wondered, you know, what type of referral was being made. Do we, and again, as I just said, you know, is there a trend, any particular comment? Is it just, oh, well, you know, a safeguarding issue was that my elderly parent was left waiting far too long, because that might constitute a safeguarding query from some people. But yeah, so it was just, you know, Lucy, something about, you know, what were the questions? What were the comments, I mean?
Sorry, we're just double checking with each other. We don't have that breakdown in front of us, but we can get you some further information on that. What we do have is where the referrals are coming from and what organisation, and then collectively we have the trends that we're seeing in terms of those referrals. So this isn't specifically just from ambulance colleagues, but this is just generally, we know we collect the information around whether it's neglect, emotional or psychological abuse, allegations, financial abuse, physical abuse or sexual abuse. So this is the we have this broken down to the queries we have, and then where we see trends, the majority of those we're getting in terms of inquiries is around neglect. Again, I'm not linking that directly to the ambulance queries. We can get that breakdown detail for you just to let you know. But I think what we were particularly focusing on was those referrals that didn't necessarily need to come to us and they weren't a safeguarding concern. So it's around consulting with and working with our colleagues in these sectors. But we get all our queries come from, we track where they all come from. So it can include from practitioners, social work practitioners, care homes, dom care providers, family members. You know, we get police, clearly, you know, so we get referrals from a number of partners. We just particularly highlighted that as an area of focus.
So I've obviously misinterpreted this. It's not referrals against the ambulance service. It's referrals that have
Oh, no,
been made
No.
by the
by the ambulance service themselves.
Yeah,
Yeah. And I think as you suggest, they are under incredible pressure. So speaking bluntly, potentially they may be trying to, because of their anxiety and the pressure, they're covering themselves, I guess, in a way, saying, I've encountered this situation. It could be a safeguarding issue. I'm gonna refer that to social services safeguarding, when with a bit more education and understanding around the processes, perhaps they could report it via another route or something similar. But because of the pressure they're under, potentially they might, as you pointed out, they might be just straight to safeguarding, because at least it's been done then, if you see what I mean.
yeah. Thank you, everybody.
Thank you, Cheryl. Councillor Jeff Jones.
Yeah, thanks, Chair. Yeah, just a couple of points, really. CAP, I think, CAP's been a marvellous introduction, actually, into social services. But the figures have actually gone down. I know Louise actually said that I think people better understand. Does that mean that people don't go to CAP now? They can go directly to other members of social services? Why is there a decrease in numbers actually going to CAP?
Yeah, I think so. For people, correct me if I'm wrong, people who are already known to us and perhaps already working with the team, perhaps previously if they had a change of circumstances or something, they might have gone back in via CAP, but now they are going directly to that team. Is that correct?
That's absolutely right. And I think in conjunction with that as well, we've seen, by reflecting on this annual data, we've also seen a change in the other referral sources as well. So it's not just, as Louise described, we've got people that we're already working with are going directly to their social work teams, which is better for the customer, and absolutely as it should be. So they're not having to tell their story again to the front door. But it's also, we're seeing a decrease in unnecessary referrals, people coming through to CAP from other organisations such as housing, the police, and again the ambulance service as well, because again they've got better understanding of what CAP is there for, what the common access point is there for, and they know who to go to directly with their query. So it's overall very positive in the sense that we're better communicating where people can contact. So it's not just clients themselves, but also our partner organisations as well, which is overall a good thing, because of course that releases capacity in the team for them to focus on our new clients that are coming through and having the right conversations with them at the front door, which does take more time. So we have also, not part of the annual return, but you'll see in our regular performance reporting that we've seen the numbers of overall demand go down month to month and the wait times go down for people to have their calls answered. So overall, just improving our customer service, really.
Okay, thanks. Yeah, one other thing, I don't know if I've actually missed it actually in there, discharges actually from hospital, and the capacity actually to get people back into the community or into residential care or whatever. What's the situation actually there? As I said, I'm not sure if I've missed it or not.
No, it's not actually part of the annual return specifically, although those same people would be encompassed into our people that are moving into reablement, certainly. So in the section where we talk about care and support plans, we have new care assessments rather. There is a section that talks about reablement and people starting and leaving in reablement. That would include a cohort of people who have come through the hospital pathways. But we don't specifically, as part of the annual return, it's not part of the Welsh Government metric to drill down into hospital referrals. But I think, as previously mentioned in one of your previous meetings, that is an area that we're looking to expand upon and improve our reporting to you as part of our regular performance reporting.
That also the hospital discharges on our next meeting. So maybe you can look at it more closely then, Councillor Jones. Are there any other questions? Dave, you want to say something? Dave
Yeah,
Howe?
to get that. Thank Amy, Lucy, and Councillor Gibbard for their reflection on the annual report. Really positive overall. Just on that last bit from Councillor Jones, this, I think at last Governance and Audit Committee there was a feedback from Welsh Audit Office undertaking a review of effectively hospital discharge and how it was working, which was quite critical of our region, and then by default quite critical of us. It was actually based on quite historic data, but nevertheless, it was reflecting. We did have a real challenge, and it did certainly appear like we stood out as a region, as arrangements not working well. What I think didn't get fed back to Governance and Audit Committee, but I suspect it will come back on the agenda, is actually that historic picture has turned around radically, including in the last few months. So where we look like, if there was a league table of how well your, the overall arrangements are working in a health board area, we were bottom of the division in Wales, and quite starkly at the bottom of the division. We're now in second place. Yeah, not in first place. And we'd quite like to be in first place and be in the Premier League rather than Division 1. But we've moved up, significantly over a relatively short period of time. And lots of the work that Cabinet Member Lucy and Amy have been reflected on, though whilst not in detail focusing on those areas, they're all bits that are creating the conditions in which we as a council are playing our part in that improvement. It's not all down to us. The problem was never all down to us. But nevertheless, creating good arrangements, consistent with our aspiration around our target operating model is helping. And then there is some, very detailed work, happening as well. So it is a significantly improved position. So not something that we can be complacent about. It will need to be a more detailed area of focus as, going forward as part of that further transformation, as Lucy's described. And it's good if you've got that on your next agenda. We can dive into that in a bit more detail. But given that you've asked the question, Councillor Jones, we can give some immediate reassurance. It's a vastly improved position from the one that, well, sure, if any of you are in Governance and Audit Committee, I think you've probably been quite alarmed by what Welsh Audit Office were describing, but they were doing it was almost over a year out of date, the kind of stuff that they were reflecting upon. But anyway, we'll go into it in more detail at your next session.
Yeah, thanks for that. I must admit, I'm on the audit committee. I did actually see it. I couldn't quite understand why it wasn't in your report as well, but you've explained that. And I must admit, the response from the audit committee was not very, the Welsh Government audit committee was not very clear anyway. So I'd appreciate perhaps if we can, we will bring this up in the next meeting anyway.
Yeah, great. Thanks. Councillor Jones.
Thank you both. Are there any other questions? No. Nothing. Okay, thank you for the report and thank you for those that question. We go on to item 10, the draft work plan. Anybody got any queries? No? Okay. Thank you very much. Can I just close the meeting then? Thank you all for attending. Bye, everyone.
Thank you. Bye-bye. Bye-bye.
Oh, thank you, Chair. Bye.